About Glanzmann Thrombasthenia. So this is a platelet dysfunction disorder where there is whereby aggregation of the platelets is affected. In platelet aggregation, usually involves the 2B and 3A, 2B 3A protein, which involves the combining of the two platelets. So in this case, that function is affected, and the platelets are not aggregating well. So as a result, there is prolonged bleeding time, and this condition is autosomal recessive. The platelet counts is normal, as compared opposed to Bernard Solia, where you find that the platelet count will be low. So in this one, in this case, Glanzmann Thrombasthenia has normal platelet count with normal morphology of platelets. In the ristocetin test, which tests platelet adhesion, is normal, as opposed to what happens in Bernard Solia, where you find that the adhesion is reduced. But ADP, which causes that platelet aggregation, will not have its normal effect. So there will be reduced platelet aggregation when ADP is given. The proton thrombin time and activated partial thromboplastin time are normal. This is because the Glanzmann Thrombasthenia does not affect the clotting factors. So this is a disorder of primary hemostasis. So this is where the main concern is the formation of the platelet plug, and we know that conditions which affect primary hemostasis as opposed to secondary hemostasis. With primary hemostasis, if it is affected, the bleeding that you get is mucocutaneous bleeding. So these patients tend to present with bleeding from the nose, bleeding from the gums, bleeding from menstruation. This is the usual presentation, as opposed to patients that have, let's say, secondary hemostasis problems like hemophilias, which tend to bleed into joints. These patients, they bleed, but they bleed on mucocutaneous bleeding. Then the treatment, usually the mainstay of treatment for these patients is platelet transfusions if they are having refractory bleeding. And you can give the platelet transfusion also in anticipation of delivery or anticipation of surgery. But after surgery, the other medical treatments that can be given include the tranexamic acid and aminocaproic acid, as well as recombinant factor 7, which is activated. The contraindications are the drugs, the unrelated drugs such as aspirin, or the drugs which inhibit the 2B3A protein, such as abscissiximab. Other disorders that can affect aggregation are uremia and paraproteinemia, and they tend to have more or less of a clinical picture. If you are to do the blood testing or the clotting profile, they would probably have a more or less similar presentation. Thank you.